Hi everybody, my name is Dr. Roney. I'm here with Natasha, our massage therapist, and Dr. Bales, I'll call him our mad scientist, right? Natasha is going to talk about massage therapy and how it relates to pain management. And that's the topic of the discussion today. And Dr. Bales will talk about PEMF, his Firefly, thermography. So he'll give you a good insight on how he works with patients regarding pain management. So to kick it off, what we'll talk about to give you an understanding of pain is where it comes from, right? So there's a couple different sources of pain, but let's talk about soft tissue first. Soft tissue, we're going to be dealing with the muscles, the ligaments, the tendons, the nerves, right? We could have also the bone being involved as far as pain. But we also can have a neurological component to it as well, which is the nervous system. And then the other part of it, we could also have an inflammatory process metabolically in your system. So we want to touch a little bit on each of those and give you some examples too, as to what type of patient that we'll see, what resources we have for those patients, okay? So I'll give you kind of my, what I see typically and what I've seen over my career. So we may have a patient that, say, has a physical issue. They come in after, hypothetically, a sports injury or a car accident or something like that, right? That patient, say, historically, they're very healthy, they don't have a lot of issues going on, overall, whether it's metabolic issues like blood sugar or gut issues or what have you, and they just get in this car accident. So say their neck is sore and their shoulders are achy and so forth. That's a patient that if we combine efforts, I do some chiropractic work, some rehabilitative procedures on them, Natasha does massage therapy, and Dr. Bales does his work with them, that patient typically will get better and relatively speaking, get better fairly quickly. Okay, then you have another patient that may have the same issue, have been in a car accident or injury of some sort, and then also has a history of some of these metabolic issues, right? They have autoimmune conditions. They may have blood sugar dysregulation, gut issues. They may have sensitivities to foods, infections, etc. The point I'll make is some people have more going on, creating this inflammatory windup. I call it fuels to the fire. And so when they get in this accident or they have this issue going on, they already have predisposing factors that are creating the inflammation to their tissues. I hope that makes sense. So early in my career, I was seeing patients that had this, these pains and aches, and we were implementing chiropractic care, sports medicine, rehab, massage therapy, etc., and they did well. But then there were some patients that didn't do well. And they didn't do well because, as I learned with experience, because they had some of these underlying issues. So I personally can work on their structure and function, aligning their spine, getting their joints right, and they may get better. But then if they have these underlying conditions, they may need more. They may need a little bit of metabolic help in order to get rid of those, that inflammation. And if we do that lowering the inflammation plus getting their structure right is going to do them wonders. So some people might need just a little bit, and some may need all of us to be able to help them. It just depends on what they present with. But the vision of Dr. Keneally, I believe, was to have everything under one roof in case a patient needed more than just, say, myself, or just more than massage, or just more than Dr. Bales. And that's the vision, and that's what we're trying to create. So I'm going to let Natasha talk a little bit about massage therapy and how that relates to pain management.
So basically, if there's been any kind of sports injuries or accidents, or just being at the computer all the time, sitting at a desk with your arms in an outright position, things can get stiff up here. If you're sitting a lot, things can get stiff down here. Golf is a real big issue as well with the swinging in the body. Things can get really tight, and with massage, therapeutic massage, it's a slow, deep pressure where you can get into the muscles where it's really tight, break things down, because when the muscles are extremely tight, they're contracted. So you open that up and it releases off the nerves, it breaks down the fascia, when the muscles can get too tight, there's also basically it slows down the blood flow, and then you can have toxins that store in there because the blood flow is so poor. So when you get in there, it creates more blood flow, more circulation. So the massage is really beneficial for any of those things, just to get the blood moving, break down that muscle tissue to where it's soft and pliable again and not hard. If you can't do the deeper stuff, if you're dealing with any kind of cancer or Lyme disease or anything to do with the immune system where it's not so great right now, we can do lymphatic, which is moving also the fluid in the body, moving the blood, creating circulation, which creating circulation takes inflammation down. And anytime you're taking inflammation down, you're taking pain down. So that's kind of the whole purpose as to what I do. It's beneficial in all different angles. With chiropractic, it's also good to have massages as well because it keeps the adjustment lasting a lot longer. Because if the muscles are still extremely tight, then when they get the adjustment, if the muscles are still really tight, then the muscles can just pull the alignment right back out. So it helps the adjustments last a lot longer, and it's just so beneficial for the body. But of course, the pressure would also be, we would want it to be comfortable for each person and not hurt them and make it extremely comfortable but beneficial. So that's basically what I bring to the table, and it's good for anything and everything.
I've never heard one negative comment about Natasha,
No.
ever. You'll never hear it. So she's one of the best for sure. So, all right, Dr. Bales, we'll let you
First, my only complaint about Natasha is I can never get in to see her because she's always so booked.
Vice versa.
I know. Okay, so I'm going to talk about thermography, PEMF, and firefly. So first of all, with thermography, my father actually invented the digital infrared camera. It's a camera that senses heat back in 1979, the digital one. There was analog ones before that. And it was used for military applications before that, actually for missile detection. So it was used more in an industrial complex than it was for medical and bodies. But it got its way into both body and breast imaging in the early 80s. And in the realm of pain management, we can use it to track inflammatory patterns. And this is more for chronic pain patients as opposed to acute. You can use it for acute, but it's kind of overkill. So for chronic pain, let's say, for example, a patient came in and they said, oh, I have carpal tunnel, and it hurts really bad, it's really stressed here, and I can take pain pills. I don't want to do that, but I've maybe had the surgery or not, and it still didn't help. Well, what's going on? Well, I can take a thermogram of their spine and see that there's what's called a radiculopathy, which is a nerve impingement in their cervical spine that's probably causing that, and that's called referred pain. So I can treat, or anybody can treat the carpal tunnel of the wrist all day, a hand specialist, and see all that, but they're not going to get better because the problem's up in the neck. So thermography's benefit is really tracking what's called referred pain. And you can also check temperature differences called delta T's anywhere in the body. The body should be symmetrical thermally. And if it's not, then there's aberration from that indicates disease. So we can use that. It's a simple camera, just taking heat images. It's not putting out any radiation or anything. And the procedure takes all of 5 minutes. You can see what's going on. Patient can see what's going on the screen. And also, thermography can be used to track progress. So obviously, the patient's complaint and how they feel is the top. But sometimes, the condition can get better, and the patient still doesn't feel better. So it can be used to track like an initial image, and then after a series of massage, chiropractic, my other therapies, say 3 or 4 times, and see what the inflammatory processes are, hopefully subsiding. So that's a thermography. The next modality is called PEMF, and that's pulsed electromagnetic field. It was brought over to this country in the 60s by a guy named Papimi. He was from Greece. And he was unable to get it into the regular medical system because they, just like now, wanted to prescribe drugs. So he got it into equines. and equine racing. So it's really big at all of the horse races. I've actually treated a couple jockeys, and they said that when the horse wasn't looking, they used it on themselves. So every horse has its own PMF, okay? And it works by emitting magnetic fields. Again, it's non-ionizing radiation or anything. It's pure magnetic field to stimulate bone growth, which is actually FDA approved for, and to stimulate healing of, I use it specifically for the larger joints, like knee and hip, and sometimes for shoulder and elbow. So it can permeate through there and stimulate the healing of those after a traumatic injury, or I have a mat attachment for it also to run the full body to get the cells basically energized. So you're putting energy in that's stimulating the cells to be energized. They've taken dark field microscopy before and after 10 minutes on the PMF mat, and they found that the red blood cells actually unclumped. So that when they're clumped together, it's part of an inflammatory process, and we don't take in nutrients or expel waste as well. So it's good for that. So it's a good overall general. The only contraindication would be those with implanted medical devices and pacemakers. So that's the PMF. The Firefly is a culmination of 21 years of light therapy research and development by my father, Maurice Bales, and a little bit for me. A little bit I provided the clinical. And it's near infrared, red and blue lights in any combination. It can be single or a combination of the three or any two of them to stimulate blood circulation. And it does that by dropping what's called nitric oxide out of the blood to cause vasodilation, opening up the blood vessels. So if we can get blood circulating to an area, we get the white blood cells there, we stimulate healing. It also stimulates what's called ATP, which is the energy currency of every, at least mammal, every living organism. So we're getting the body to produce more energy, promote a healing process. And we can heal, and especially in combination with chiropractic and massage, we can heal general injuries in about half the time. And this is the injuries you said for the patients that probably don't have a whole lot going on. Otherwise, metabolically they're pretty good.
Yeah.
With that, let's say the car accident that Dr. Roney mentioned, about half the time for healing. Well, that's half the time to get better, to get back out on the golf course, to get back into normal life. So, it's also good for wound healing, again, about half the time. And we have some trials going now for Lyme disease and also traumatic brain injury. Also has shown some promise with dementia, and again, we have for that and for Parkinson's disease. Those aren't pain, but that's just kind of what's coming up. So as you can see, with a combination of all three of us, we can get under one roof, which is Dr. Clean's vision, we can get people better a lot faster, get you back in the game.
Yeah, I think to kind of summarize and to wrap it up, I think, again, the idea being that we understand really well where pain comes from, okay? So again, let's reiterate. It could be a patient here is chronic. We call it a chronic pain patient. They don't have a lot of injuries. They don't have a lot of, accidents or falls or traumas, right? But yet they're just constantly in pain, whether it's their hips, their knees, their back, their spine, their shoulders, whatever joint it might be. They have this chronic underlying pain. With that, there is a couple things that we want to make sure we look at. We want to look at structure function. That's my job, because if they're out of alignment, they're going to create abnormal loading stress to those tissues. So we have to make sure that we can create a good alignment. And I'll use this simple analogy. If a car's out of alignment, the tires are going to wear. So we need to make sure the alignment's good, the loading stress is dissipated throughout the body properly, right? So that's one. As that happens, the muscles shorten and they get tight, and they get less pliable, mobile, etc. So Natasha, what she brings to the table is allowing the lengthening to happen, allowing better range of motion, moving some of that junk out of those tissues to create less inflammation. So think about it. If we line them up, right, we get the muscles pliable and flexible and mobile again, get the junk out of the tissue. And then we can implement strategies that Dr. Bales was talking about with the PEMF, his Firefly. We can look at the thermography of the body and be able to tell source of the problem. Now, all of a sudden, we're combining these efforts, and then I'll add one more. And then from a functional med standpoint, we're looking at the metabolic system to make sure that there's not fuel to the fire, right? Because, you have all this going on physically, but if there's constant fuel to the fire, all this can help, but it's more of a Band-Aid than it might be a fix. So again, if we can look at metabolically the person and reduce the fuel to the fire, thus decreasing inflammation at the cellular level, and then structure, massage work, and then Dr. Bales therapies, my goodness, most people are going to get well, and they'll get well much faster if we're looking at it in that well-rounded way. I hope that makes sense, right?
Absolutely, and to add to that, they will probably stay well longer.
That's
Not just get well longer, but stay well and have a better lifestyle than even before, say, an accident, because now you've fixed all the underlying metabolic problems.
That's exactly right. So it's cause and effect, okay? And that's, again, vision of Dr. Keneally is to make sure that we're going a step further than most clinics go. So if we're looking at cause and effect, and we have enough of these resources to help the patient, they can get well quicker and, as Dr. Bales said, stay well longer. Matter of fact, we like to think we're healing them, right?
Absolutely.
Now, I'm not saying it's always easy, right? That's the part where the patient in this clinic has to do a lot of the work. We're going to guide them. We're going to help them with our modalities, and we're going to guide them. I always call myself as like a GPS. They still have to drive, but we're going to guide them down the path that they're going to be able to heal from the inside out. And that way, quite frankly, they need us less, which sounds, whoa, what? Yeah, that's what we actually want. We want to set you up and give you the power to be able to heal your body. We're facilitators of that, but we want you to be able to do that long term, okay? So hopefully that helps. If questions, if you have questions during this, let us know. We'll be here to help you. We'll answer any questions you have. Our ultimate goal is to make sure you have the resources that you need to get well. Okay? All right, gang.
Thank you.